Okay, let's get going. Welcome, everyone, and thank you so much for joining us today. I know that this is a very busy week for a lot of people, a lot of women in particular. There is an amazing amount of wonderful work being done by women in Australia and all around the world, and it's actually quite fabulous that it's being recognised and celebrated. There are loads of fun, fabulous events happening all week, and I'm sure all of you have been invited to lots of them, and I'd encourage you to go to all of them. My name's Julie Rosenberg, and I'm with AIDEN, the Australian International Development Network, and we encourage and facilitate charitable giving and investing to global causes. Encouraging Australians to kind of look outside our boundaries and see what other opportunities there are to engage. I will start the session, as we always do, by acknowledging that I am hosting from the land of the Gadigal people of the Aurora Nation. I would like to pay my respects to elders past, present and emerging. As a part of housekeeping, we will be using both the Q&A and the chat function and keeping an eye on those. I'd encourage you all to really lean into this session and post your insights, comments, thoughts, questions, and actually really see if you can contribute to this discussion. I'd also encourage you to post the Aboriginal lands that you're listening from, just so that we get an idea of where everybody is. I'm very excited for this session. I always love our webinars and I love our podcasts. I love AIDEN in general, but today I'm very excited because my very close friend and cleverest of all, Dr. Deb, has agreed to join us today and facilitate this, well, I know will be an amazing discussion. Deb is now Professor of Practice at Sydney University and is involved in an amazing collaboration, innovative joint venture with the Cancer Council and Sydney University with the Daffodil Centre. There's nothing Deb doesn't know about sexual and reproductive health, I don't think. And indeed, she could be running a webinar just on her own. And we will do that one day. But for now, I am going to hand over to Deb, and she is going to guide us through what I am sure will be an amazing discussion. So over to you, Deb.
Thank you, Julie. That's a lovely introduction, and good afternoon, good evening, everyone. It's an absolute pleasure and a real honour to host this discussion in celebration of International Women's Day. I know it's going to be very lively. We're going to get all our panellists to talk together, but it'd be great if you could also put questions in the chat or the Q&A, because we'll tackle those as well, of course. And I just want to say we could not have a more perfect and innovative group of women panellists here today to help us take that deep dive into gaining a greater understanding about some of these innovations and how they're helping to empower women to take control of their own health. So it's my very great pleasure to introduce and welcome Whitney Chinogwenya from MSI Reproductive Choices in South Africa. Welcome, Whitney. And also to Marnie Rickards, Operation Director of the DAC Foundation. Welcome. And we're going to be joined a little bit later on by Daphne Ngujiri. She's going to join us around 5 o'clock or so, and Daphne is the CEO at Access Afya in Kenya. So a great lineup, as you can see. So just to set the scene briefly, women, of course, have unique healthcare needs. These needs are related to pregnancy and fertility, so they've got choices about whether, when, and how many children to have. That empowers them, of course, to be a part of the workforce and bring an income into the family, also important. There's also other needs related, for instance, to preventable cancers, and we're going to take a little bit of a look at cervical cancer. This is caused by the human papillomavirus, and what we know is that it's associated with stigma and shame, and women can be isolated and ostracized sometimes from society because of this cancer. We've got the tools and the technology now to prevent it, so we'll hear a bit about that. But also those needs around health literacy. It's really important that women have the information to be able to recognise what's normal, when to seek help from a healthcare professional, And we know that women often, they put themselves second or third or last, and sometimes, don't always recognize those signs. For instance, for something like heart disease, and that can go undetected, unrecognized, sometimes with fatal consequences. And I must say, I do like a quote that someone shared with me, that women are typically the chief medical officers of their homes, controlling healthcare decisions, not only for themselves, but also for their partners, children, and parents. So this is why it's vitally important that women are at the forefront of technological innovations. They're the innovators, because this, of course, is because we, all of us, we know what women want and need to achieve greater control. We know what they want to use and to have that autonomy over their own lives and their own health. And we need to co-design, of course, these innovations with the end users, with the women themselves. So just a brief introduction. I know Julie's introduced me. I mean, I've been privileged in my career to work in the area of women's health in Australia and globally for over 20 years now. And I have to say, my focus at the moment is very much on cervical cancer prevention. And that's because really, cervical cancer is a disease of inequity. That's inequity within countries and across countries. But as I mentioned before, we've actually got the tools and the technologies. So the World Health Organization, Dr. Tedros Ghebreyesus, has announced we can eliminate this cancer. But what we've got to do is be able to get those tools and technologies to the people that need them, of course. So we'll have a bit of a deep dive, because Marnie, I know you visited Malawi quite recently, and we'll be talking to you about that. Overall, though, my career is really focused on sexual and reproductive health and rights. So that's including access to contraception, access to safe abortion care, and to sexual health more broadly, holistically, as well as prevention of STIs and HIV. And this really brings me beautifully to the work of MSI Reproductive Choices. I had the great pleasure and privilege, really, of working as the Global Medical Director for MSI Reproductive Choices. It's an amazing organisation with programs across 37 countries. And it's an absolute pleasure to have you here, Whitney, to talk to us about all that's going on in terms of technology and more with MS Choices. And of course, MSI Choices has a bold vision where by 2030, no abortion will be unsafe, and everyone who wants access to contraception will have it. And of course, digital technology has a critical role to play in this strategy. And you're a marketing specialist, so you've been intimately involved in developing and designing and rolling out these technologies. So I'd like to hand to you now and tell us some of the ways that technology is helping MSI to reach those women in need. Thank you.
Thanks, Deb. And thank you for having me. So as you've already mentioned, we do operate in 37 countries. And often in the countries that we operate in, we're usually the largest provider of reproductive health services, including safe abortion services and contraception services. And you are right, our vision is quite bold. So we had to tap into some digital innovations to be able to find innovative ways in which we could improve our efficiencies and strengthen our ability to contribute to the wider sexual and reproductive health ecosystem across the world. And I think we were talking about it earlier. In countries where we operate, in South Africa, for example, abortion care is legal, but we estimate about 50% of abortions are still being accessed in the informal sector and often really unsafe. So we really had to lean on a lot of the digital technologies that we have to empower women with access to information and services. So we have 3 ways in which our digital technologies are helping us. The first one is it is helping us to empower women with knowledge to take healthcare into their own hands. So we do this through our websites. The majority of our countries have websites which have all the information that they need, whether it's on where to access services, what services are available, where it's safe for them to go, who they can speak to. All of this is available on our websites. And in 2022, we had nearly 1 million visitors to our country websites just accessing this information. And a lot of them convert into some sort of interaction with our contact centers, which are really the backbone of our operations. We had over 3 million interactions in 2022 with our contact centers across our network of countries. So we're really leaning into this. And in 2018, we just had the phones that people could pick up and reach out to somebody in our contact center, but we've since widened the ways that women can reach out to us. WhatsApp has become very popular with our audience. We've got Facebook, we are on Telegram, Viber, anything that's relevant in the countries that we operate. We do have a platform that women can reach out to us through. And even when we look at our demand generators or community mobilizers within low resource communities across the world, we have empowered them with a technology which we call Community Connect, which they use, does not need Wi-Fi, but they can use it to interact with people in their communities and give them information that they need. Another thing that this digital technology has helped us to do is to connect people with convenient quality services and products. So we have mapped out everywhere within the MSI ecosystem where women can access services from us. This is available through our contact center. So as I've already mentioned, they're very busy. They're giving women access to services and pointing them in the right direction. All of this is also available on our websites and social media channels. And we have also tapped into the telehealth market, particularly on tele-abortion services, which we are now providing in a couple of countries. So this has really been made possible by digital technologies. And then finally, we do have technologies that help us make healthcare experiences easy and responsive to our clients' needs. So we have digital feedback mechanisms which clients are using to give us feedback on what we can do to improve our services and everything that we do. And through digital technologies, we're able to collate this feedback, analyze it, and actually come up with something that is actionable that we can use. So we are leaning quite heavily on these strategies to improve our services and achieve our vision.
Thank you. I mean, it's fantastic to hear, in fact, the breadth of what you're doing with these digital technologies. I mean, not only are you being able to reach more women to provide your services, but you're also sort of, I always think of it in terms of trusting women. You're giving women the information that so they can make decisions themselves. And I think that's a really important thing, you know, putting it in, you know, that information in the hands of women so they can then feel empowered by it. So I think it's fantastic. And I do know, you know, certainly here in Australia as well, COVID, you know, there are many, many terrible things with it, but there were some positives. So it did push forward. You know, certainly many countries adopting telehealth because obviously women couldn't get to service it in any other way. So I think that's a really important thing. And I'm really interested that you mentioned about WhatsApp and Viber and, you know, just being very flexible, because I know in our work that we're doing with cervical cancer prevention in the Pacific countries, we're in the Western Highlands of Papua New Guinea and in Vanuatu, and there again we have it's a digital registry, so to be able to remind and recall women to come back for testing, and the preferred mode of action is always WhatsApp. So business is always done by WhatsApp. So that's fantastic. So thank you. So Marnie, I was just going to ask you whether there was anything that you know that you wanted to ask, but before we do this, I'm just going to say welcome to Daphne. So welcome, Daphne. It's very lovely that you've been joining us now, and we're glad you've joined the chat. So welcome to you. Marnie.
Well, thank you. I heard earlier today that Daphne's got a newborn at home. So I just love, you know, on International Women's Day, you've got the full juggle going on that is so representative of all of us on this call. So thanks for making time, Daphne. I just want to say, Whitney, what you were saying about WhatsApp, and I was going to talk about this later, but it is, it's so accessible for so many people, and everyone is using it. And I really love how it's been taken up, not just with dealing with communications to patients, like from MSI to someone. It's actually like in terms of healthcare worker strengthening and networking, it's huge. It's just huge. It goes from, you know, we've seen evidence of biomedical engineers spread across Mali in different really remote hospitals, and the only thing connecting them is the WhatsApp group, and they say, hey, I think I've identified the problem with the oxygen concentrator, what do you think? And they take a photo and they send it, and then there's 20 other people in the same boat. And we have, so I actually think it's one of these you know, no cost revolutionary tools for really kind of, you know, just primary healthcare Yeah,
Fantastic. It's fantastic. Thank you, Marnie. And look, we're looking forward to coming back to you, to hearing all about your, all the things that all the information you've been gathering about the various sort of technologies in your visits is fantastic. And Whitney, what I thought would be useful for people perhaps would be to just explain a little bit to, our participants around how it works, how MSI teleabortion and courier services work to ensure women can be supported to proceed with that self-care medical abortion in their own home.
Thanks for that. So our teleabortion services actually started during the COVID-19 lockdown period and started in South Africa and the UK. And initially it was a way to reach women only during that period of time. But once we started to roll it out, we realized that teleabortion services were just as safe and effective. They offered better privacy to women, so women actually preferred them. They were more convenient, so people didn't have to travel to our facilities to access the services. So the uptake was great. And it also allowed us to reach women, more women, especially those that were not within the immediate catchment areas of our facilities. So this became a really key service channel for us. And how it works is that, again, it leans quite strongly on our contact centers. And I mentioned earlier that they are quite the backbone of our operation. So our contact centers are toll-free, and women are able to contact us without acquiring a fee for it. So this is where our professional nurses or midwives who are providing the services are located. They're providing their consultation services over the phone or over WhatsApp call, which is also very popular, talking women through what to expect, helping them figure out their gestational age. And we've got a digital gestational age calculator that they're using to make sure that they're right within the gestation that they can use the medical abortion pill. And then once the consultation is done, we are using different courier services, and they differ within the countries that we're in to get the medication to women. So if they're in slightly more urban areas, it's taking between 12 to 24 hours to get the abortion pills to them. And if they're in slightly more rural areas, it may take up to 48 hours to get these pills to them, but it is really effective. And then we're also using our contact centers, or the midwives in our contact centers, to provide a sort of continuum of care. So those clients come back to us should they have any questions, that they're having side effects, if they just need to talk about, is this normal, what am I going through, just needing support from our midwives. They're able to do this through our contact center. And this is a service that they were providing anyway, even with women that come into our facilities. But it has really been strengthened with the teleabortion services. And since that pilot in 2020, we have since rolled out these services in Ghana, Cambodia, and Pakistan, and the uptake has really been great.
No, that's fantastic, because I know your contact centers, you've also got information for adolescents, haven't you, and survivors of gender-based violence, and just briefly how that works. I suppose it's an interesting thing. There's a lot of new development around apps for survivors of gender-based violence, which, because obviously if someone's going on an app, we need to make sure that we're not increasing any risks to that person, that the safety planning with, the special screens that can disappear or even contact the police should it be needed. But I was just interested in that, and maybe Daphne, I'll bring you into the conversation. It's great that you've joined us now. So, but Whitney, just tell us a little bit about this, and then I'm going to just bring Daphne in and then come to you, Marnie.
Okay, so with our contact center, I mentioned earlier that we had about 3 million interactions last year, and this could be phone calls or digital ways to connect with us. And about 8% of that was with adolescents. And what we've seen over the years is that there's been more use of our digital platforms, because people are actually able to just ping us a message without anybody overhearing them. So adolescents feel really comfortable using these platforms to reach out to us for information, confide in us, because sometimes they actually don't need a service, they just need some sort of advice on the ways to navigate their lives. And the same applies to women with FVG survivors. They're able to contact us without people overhearing them. They're able to get the information that they need on their phone without anybody accessing that information. And we have great systems within our contact center where we're actually able to follow the entire client journey and make sure that that woman gets the help that they need. So from the time that they contact us to the time that they end up at an access point, we're able to follow that journey and make sure that they get the help that they need. And we've been able to help quite a lot of women.
Wonderful, thank you. Daphne, I know with your work as CEO of Access Afia, you're obviously involved in lots of digital technology, and I just wondered if you wanted to just say a few words in response to what Whitney's been talking to. We're obviously going to hear in detail about your service in a minute.
Yeah, thanks so much, Deborah. I'm really pleased to be here. As I was thinking about this webinar, I think we're all here living, breathing, all the challenges and opportunities for women. And the thing that I was reflecting on is, are we doing enough in terms of equity? And here I'm talking about all the women and men and communities that the organizations here serve. And felt really motivated. I think that there's still much to do. There's still much left to do, but they have also been really great strides, as we've heard with some of the work that's going on here with Whitney and the rest. So yeah, no, I think a lot of things that resonate with what Whitney has just talked about, in our context as well, which is really meeting people where they are, even if that's Viber, and WhatsApp and all these modalities, and taking care out of the context in which we traditionally provide it, and going out again to meet people where they are, increase convenience and increase information. I think those are consistent themes as well with at least how we have seen impact created in our work as well.
Thank you. It's lovely that you're here with us now. And Marnie, I'm going to throw over to you now, because you travel extensively, don't you, with your work, your projects around the world, that the DAC Foundation is supporting. And as I mentioned before, I know you were recently in Malawi, and I can see actually there's a question in the chat around, hoping to hear how we'll align International Women's Day theme to reducing the inequalities in cervical cancer. So we might want to dive into that a little bit, but I know you've got lots of other examples of how we're using high-tech and perhaps sometimes low-tech, approaches to suit women where they're living. So over to you, and please do tell us what you think are some of the key challenges that women are facing and how we can overcome them.
Thanks, Deb. There's so many things that I'm thinking of just having this conversation here, but, the recent travel that I did, there were three different contexts, and that's the thing, each country is unique. I visited Malawi, where they've got such a low income that the health system is really threadbare, just because it's just so fragile because there's no money. And then I went to Kenya, and I was in Nairobi. I didn't see you, Daphne, but, Nairobi is just buzzing with technical and digital innovation. It really seems to be a real hub at the moment. But yet you've got rural healthcare that is still, has significant needs. And then the last place I went was Somaliland. And that was so interesting to see. They've got a robust private health system. But this question of equity that you brought up, Daphne, I think, the equity is not there because the public system is so poor. It's such a huge difference that the poorest women just don't get that service. So I think there's when we talk about digital innovation, there's different kinds of innovations, and sometimes it's that low technical innovations that work the best in some situations. But I made a quick list of things that I thought that were really interesting, that what I saw as I was preparing for this. I think one of the biggest things has been community health workers and the smartphone apps that they use, which guide them to collect data, that prompt them to make reports, to visit patients, to follow up patients. And that has really revolutionised a lot of health in really remote settings. And I visited one community health worker program in Malawi called Wandakwesa, who have a cervical cancer project. So we'll circle back to that. But the other technologies I was thinking is the actual device that treats the cervical cancer if it's precancerous cells, which is the thermocoagulator. It's just a handheld device that can be used without a whole, like it's a couple of $1,000s. And as long as you've got the right systems in place, you've got a solution to treat at the point of care, which is just, amazing technology. The other thing is, just AI and telehealth. It's huge. Hearing about the, Whitney with the teleabortion services, that's such a game changer. I'm so interested in finding out what barriers you've had with government to that, because I can imagine that's a huge barrier in a lot of countries, especially a lot of, religiously conservative countries. And then the other thing, which I think Daphne will know more on than me, is the small point of care ultrasounds. I know that Access Afya do like a smartphone compatible ultrasound, which is amazing product. It's no wires, it's very portable, perfect for somewhere like Nairobi, but it's not going to be perfect for somewhere like Malawi because it's just too low resource to really take it up. But over all those technologies, the things I'm going through, it still comes back to a couple of things. For me, when I'm going out and visiting projects and I'm saying, okay, what is best with the digital and the innovations and the equipment, which is my area of focus, is medical equipment and electronic devices. And there's three things. There's healthcare worker training, there's actual staffing, and there's clear referral systems. And Whitney talked about being there alongside the patient after the abortion services. That kind of care is critical to any robust health system. And so those three things are really important for technology. So you might have something like an Embrace infant warm-up, which is really a great idea. You wrap a newborn who maybe the mother had a C-section, the newborn's cold, has to go to the NICU, the neonate intensive care. You wrap them in the warmer, you take them to the NICU, but you still need A, B, and C. You still need the healthcare worker training, and you still need a staff member at each end, and you still need the clear referral system so that everyone knows where the baby's going. For that, it all comes back to that for me. And then the community health workers, the referral systems are just critical.
That's fantastic. I have to say that you've raised that, Marnie, around the community health workers, because I do agree with you that one great thing that technology can support is what we call sometimes that task sharing. So it allows community health workers to do tasks which perhaps would otherwise have done by more highly trained people, and certainly nurses, such a valuable workforce and often underappreciated and underutilized, certainly here in Australia as well. But it's really a fantastic thing. So I know we've been talking a little bit about cervical cancer prevention, and certainly in our program, it's called Elimination of Cervical Cancer in the Western Pacific, and we're working with the Ministries of Health there. And it is around exactly what you're saying, Marnie, around that training. So what we're doing is training the nurses around screening, so the women actually take their own self-collected swab. And that's point of care test, as you said. So the technology, the results are there within 60 minutes. So then the women know immediately whether they can be offered treatment. And most people will be negative, they won't need treatment. But then they can be offered that treatment if they're on a remote island in Tuvalu as well, or if in a remote area of Papua New Guinea. You can actually carry these very light handheld devices, these thermal ablation kits. We used to have to, have enormously heavy gas bottles with cryotherapy, and it was just, it was hopeless.
And you couldn't reach risky, women, isn't it? Like it's risky carrying those big things around.
It's fantastic to have these sort of appropriate technologies, which then it's all about the training, it's all about the staffing, and then of course, for women that you can't treat, because there will be some who are ineligible, they need to be referred. So you absolutely have to have those referral pathways. But again, the technology can help, and there's some amazing stuff happening with AI, as you say. So, back to base, if a gynecologist on a remote island of Vanuatu is potentially looking at a woman's cervix, he can get, or she can get, all the backup, in real time from an expert somewhere else, and again with AI, again get those predictions. So it's very exciting times, I have to say. Now, I think you were asking, Whitney, you also, of course, have a lot of task sharing, and I know, just tell us a bit about the MSI ladies, because I know they play a very important role. I remember them well, and then we'll come to you, Daphne.
Thanks, Deb. So our MSI ladies are a network of women that actually operate in the communities, providing services to women, especially in communities where there isn't a hospital or a clinic that women can go to access services. And I like what Marnie was talking about with the referral networks and being able to track all of that. We do have a lot of systems that we use, not just in our centers, but our MSI ladies are using them to communicate with, whether it's the medical teams that can assist them with any issues that they may be facing in the field, whether it's referring the women that they're working with to a bigger facility where if they need a little bit more help and they need to refer them, they do have systems that they're using to refer them to those access points. And we also have our outreach channels that are doing more or less the same thing. And I think what Marnie was speaking about earlier is that there is still quite a gap in the public sector, accessing of services in the public sector. And as MSI, we're also doing a lot of work. Initially, it was just partnering with public sector facilities to provide services. But now we're actually calling it public sector strengthening, where we go in, we sort of train them on providing these services, and then we sort of hand over the service provision to them and step out of it. And I think that's been really useful, and there's been quite an uptake in countries, and definitely the goal with that is to sort of balance the inequalities and make sure that all women have access to services.
Thank you. And I'd just like to say thank you to Melinda for putting that very important comment in the chat. So community health workers are the backbone of all healthcare and need to be paid. And it's absolutely right that, with this task sharing, there has to be funding and commensurate payment. So, it's absolutely vital. So thank you. And I must say, community health workers can play such an important role in palliative care as well. And again, but need the right training, but also need that remuneration as well. So thank you for that comment. So Daphne, I'm going to come to you now. So we've been discussing the role of technology, delivering healthcare, and of course, Access Afia. You've developed a physical and digital healthcare network using high-tech powered, I've got to get this right, asset-light micro clinics. It's fabulous. And comprehensive online care and patient health data to engage patients throughout their healthcare journey, all the way from diagnosis to treatment. And I must say, I was very fascinated to read online around your the digital slums, as it were, and the work that you're doing in parts of Nairobi. So it can be adapted, of course, for low resource settings. So local healthcare workers replicating the model in their communities through franchises. So there's a lot of exciting things happening. You've got your virtual clinics enabled on a phone people can access anywhere. So can you just tell us a bit more about it?
Thanks, Deborah. I'd love to. Maybe I'll start with a bit of context also. So we're in Nairobi, capital of Kenya. We designed this model, though, in the informal settlements of Nairobi, within for Kenyan people and using Kenyan healthcare workers. And just like, we've heard described from the other panelists here, it's a system. Healthcare is complex, and it's a system. It's the technology, it's the training, it's the people, and the bringing together all of these elements, which is essentially what Access Afia does in a comprehensive way for primary healthcare. So we designed these comprehensive primary healthcare clinics, 500 square foot space, fit for purpose, a bit of cross training, across the groups, but really leveraging technology to lower costs. And so this model is then replicated by franchisees. So we then partner with local healthcare workers to replicate the same model in their communities under a franchise model. And still, in terms of a bit of progress, while we've made, significant strides in some of our global health indicators, we still have about 49% of women who are
Daphne, we might be losing you a little bit. We'll stick with you. We might have lost you
for 50% barriers to this information.
No, fantastic. We lost you just for a little bit there, but I think we're
all right. You can hear me?
Yes,
good.
Thank you for explaining it. And in fact, I got the terminology wrong before, because in fact, what you're talking about is smart slums, isn't it? Smart slums rather than digital slums, but it's very interesting concept thing. Before I come back to you, because I'm going to ask you about the opportunities and challenges you're facing with Access AFIA, I just want to come to Marnie, because there's a bit of interesting chat here, just following on from the payment of community health workers. And so, Marnie, do you want to just tell us a little bit about Community Health Impact Coalition?
Yes, I think someone in the chat added the comment in about that I'd sent to the panelists as well, about the Community Health Impact Coalition, which was founded and have a number of key kind of principles. I'm not an expert on this, but key principles of what a good community health worker program should be. And up the top of the list will be that community health workers need to be paid. They need to be supported, they need to be trained, they need to be kitted out, and they need to be paid. And that's the backbone. And the coalition has done some great things. They in terms of getting people to join the coalition and to work towards paying their community health workers. So using the example very quickly of Wanda Kwesa, who I was talking about with community health workers in Malawi, who also have done a small cervical cancer project. So they have community health workers, which they train to the national standard, and then they pay. So tick. And I love that they're really closing the gap, because that's what community health workers is. It's closing the proximity and closing the gap. If they don't get them with the community health worker, they send a nurse on a bike. You can call, a nurse on a bike can come to you if you're in one of the catchment. And if that doesn't work, they have a bi-monthly outreach clinics where you come, and there's a team of doctors, maybe 10 clinicians and doctors. And if that doesn't work, you go to the hospital and you close that gap. You just narrow it and narrow it down, so there's no way the patients can get away from you. But the key starts with the community health worker, because that's proactive.
Yeah, no, I think it's a really important point. And I think actually the care of healthcare workers is also very important. And I know perhaps Daphne, we're going to ask you about the challenges, and Whitney, I'm sure you're familiar as well with. I know when we shifted to telehealth, it means that you see, you talk to more patients, you work faster, and in fact, you can actually reach burnout a bit quicker, I would say, as a healthcare practitioner. So, how do you actually deal with that? And so maybe, Daphne, I'll throw that to you, as you're running digital services and virtual clinics, and looking after the health of the staff, of course, is also important as providing the care. So handing to you about those challenges and opportunities.
Thanks, Deborah. Perhaps I'll also pick up, from where Marnie kind of left off there in terms of challenges, and maybe describe, one of our interventions, which is also this community health worker agents. We equip them with mobile phones mapped to a range of health information, like reproductive health, chronic disease, maternal care, and they serve to bridge a literacy gap. They serve to bridge a digital literacy gap and a smartphone penetration gap. So they, serving a huge purpose here, alongside also the education. And they also offer convenience or engaging women where they are. Like I said, it's just a critical element. And usually in our case, these are small business operators who are selling wares or foodstuff in the community, and they don't have the luxury of time or somebody to help them in their business to leave, to take a health class or to attend a clinic. And so it's really important that there is this kind of agility built into it, leading me to then, one of the challenges that we face with that, which is really, we pay the community health workers to do these tasks. And in a world in which at least Access Afia operates, and in finding sustainable ways to reach people, there are elements of our services that we provide that we continue to identify as requiring kind of grant funding, a blended financing, to be able to continue to operate them. And social enterprises like Access Afia continue to require this blended financing because of these nuances in the way that care has to be delivered for it to be effective and kind of going with what works. Another example of that is our virtual clinic, M-Daktari. So this allows women to chat with the doctor privately, on demand, and in a language that they prefer. So they can text or they can request a callback. We've seen a quick, a big jump in interest, particularly around sexual reproductive health in our users. We see a lot of technology built for smartphone-based users. And again, a very common theme in this discussion is low-tech, kind of solutions. And so what we need to kind of see here more is on the regulatory side, technology that is more adaptive to the local community, so built for feature phone users perhaps, and is more I think user-friendly than some of the what we currently see, so provide a better user experience, and also from a regulatory side in terms of the costs of providing those services, even on basic phone and for basic phone users, can be quite high if you're looking at the telco pricing, taxation, even on kind of health messages and things like that. So I think those are some of the two opportunities that I think would drive tremendous push behind some of these efforts.
No, that's really important. And I suppose as you're talking as well, I'm also thinking about the sheer volume of apps and information that comes at people, and how we can support that sort of digital literacy, but it's health literacy about working out what are credible places to look for information and what are not, and right. I think that's a bit of a challenge. Whitney, I don't know whether you want to tackle that one, just around how we do ensure that I talk to many young people and they go online and they can end up down all sorts of scary pathways some ways, because sometimes, particularly around abortion care, sometimes they can end up on websites that are very distressing. And so, what are the things that we can do to stop that? Maybe there's no easy answer, right? But I think it's just something we all have to think about and think about how we can tackle that.
Definitely no easy answer. And I think this is a challenge that we're facing more and more. We are actually in the process of engaging Google and all the Meta platforms and YouTube to see how we can actually start to put in place some regulations that can actually help them to identify the right sources of information that they should be pushing out to women looking for information. I think one of our biggest challenges, especially as we go into the digital space and trying to push abortion material, is that there is a sort of silencing. We're not able to put our information out there quite as openly as other people are. There's a lot of our information that's put off or taken down the platforms by these facilities. So I think this is definitely one of the biggest challenges that we're now going to face and now going to have to tackle. And I think the answer to that right now is more advocacy and just making sure that we get everybody on board, people sort of understand our vision and what it is we're trying to achieve as a sector, not just as MSI. And I think this is something that a lot of organizations working in reproductive health are facing.
I think you're right. It's about building that trust, and people know that you're a trusted place to come, like you, Daphne, with Access Afia, of course. So, Marnie, I wanted to circle back to you now, because I know you've always got lots of fabulous ideas and responses, and just really, we're coming sort of to the end, not quite yet, but just what excites you, as a funder, really, what excites you about this work and the use of technology, and if we link it to women's health, and what is the message for philanthropy here?
Well, okay, so the things that I guess excite me, that are coming to mind from the conversation that we're having now, I'm very interested in how ultrasound access can strengthen systems, and I guess I'm mostly interested in midwife ultrasound task shifting programs, and that's one of my little passion areas. There was a story that we had in Malawi where the mother was told to go to the hospital to get your scan. We worried that you might have a problem. She went there for the whole day, spent her money, not that she had enough money to get transport, sat in the waiting room, and then was yelled at the end of the day by the doctors saying, you don't even have a problem, you're just pregnant, go home. And so that just leads to a lot of negative things, negative health-seeking behaviours. She did not get scanned, and there's all sorts of things you can pull out from that example. So one of the things we're doing is partnering with one of the midwife training colleges, and they're now going to train their midwives in how to do scans, just to do the first 6 things. So, the size of the baby, is there a heartbeat, where's the placenta? And that to me is really it's low tech in one way because it's old technology, but the way the innovation of task shifting some parts down the chain is really exciting. And that uses, this program in Malawi uses WhatsApp as messaging, and so again, having a buddy system, there's all sorts of things. I could talk for ages. So by that, because it's the WhatsApp pulled in with the ultrasound and task shifting, which might move the dial a bit, because there's never going to be enough radiologists in the next 10 years in Malawi to cover all the pregnancies. And then the other thing, this has just reminded me from what you were saying, Whitney, about some of your programs. It's just there's a really interesting system that a group in Kenya have done, Jacaranda Health, which is it's kind of AI is baked into it, but it's an SMS service for new mothers. And so you enroll all the new mothers in, say, one county, get enrolled into this service, and the first SMS they receive is a prompt to say, do you consent? And then after that, they get a whole lot of updates like, oh, you're at 49 days of your pregnancy, you're at 15 weeks, this is what you can be expecting. And they can text back with questions. And the guys at Jacaranda fed in 100,000 questions, mixed in English, in Swahili, and then the 2 languages mixed. And so an automatic message goes back. And then, they might reply and say, no, that wasn't what I was after, in which case it gets prioritised to a real person on a help desk. And that is such a good intervention, because you're really bridging that gap, straight from, the person that's sitting in their bedroom that's worried about some spotting and some bleeding to care. And they can even connect them into the hospital. And that's how AI is going to, to help at that primary health level, I think. So I get a bit excited.
Oh, it's really very exciting to be excited. It's great. It's wonderful.
I know that Daphne knows a lot about the ultrasound side as well, because I think
I was going to say, Daphne, looking forwards, what are the things that excite you really around, this technology of the future that's going to be appropriate for low resource settings?
Yeah, I mean, the digital transformation, particularly with regard to diagnostics, because this has been hard to reach for a lot of low-income people, whether you're being served in a public facility or private facility, or even by an informal, unregistered provider. And without the diagnostics, then the reliability of the diagnosis and the treatment is obviously a problem. But with all the innovation around digital health diagnostics and the point of care ultrasound being one, it has, for us, it was a tremendous shift. We were using, kind of the big traditional ultrasound and a sonographer, and we were still doing asset sharing to try and, lower the costs. And then in came these point of care ultrasound diagnostic devices. We use the Butterfly Inks ultrasound, and there's several others on the market as well. And we saw an over 400% increase in uptake of ultrasound. We were able to tackle, conversations about ultrasound that were previously barriers, because as we were then starting to market the device and the availability of the service, women thought that the ultrasound could cause problems for your unborn child. And it was the reason that they weren't taking it. So to see this huge uptake after tackling that misinformation, but also because the price, we were able to drive the price very low to $7 for a scan. We start to see huge uptake, and now over 40% of our pregnant women that we care for are getting a scan. So like Marnie, it's very exciting to kind of see very low numbers go to
it's fantastic to hear.
Really huge impact. So that's just one of the examples I think that this had that I'm particularly excited about in the digital health diagnostics field.
Thank you. It's a wonderful example. And as Misha Coleman says, when she was in Africa as a midwife, all she had was a fetal stethoscope. So, and as someone says, $7 for a scan is incredible. So yes, or there we say, Marnie says $7 is very reasonable. So Whitney, just a few words from you now. I know we're driving to almost to the end, but it'd be lovely to hear your words about what's exciting you about the future and technology and where we're going.
I think definitely when we look at the telehealth, for me, it is really exciting. The things that we've been able to do with our teleabortion at the moment, we are now looking at expanding, trying to use video chats to reach women. Right now, our medical advisory teams that are global are able to support doctors that are either doing C-sections or procedures in remote locations through video. So how can we take some of those technologies to support women? So we're really, really excited about the direction that our tele-abortion services are going.
That's wonderful. So I suppose if I think, what am I excited about? If I come back to the world of cervical cancer and how we can eliminate it, and you talked about driving down prices, that's exactly what we've got to do, because we've got these amazing human papillomavirus HPV tests, but they're still just a bit out of reach and too expensive for some countries, and we just need to be able to make these accessible for all. And then we can then treat the precancers with those amazing, thermal ablation devices, and we can actually rid the world of this absolutely dreadful cancer. So that will be my dream ahead, and link it to the databases with the, with the WhatsApp messaging as well. So I think technology, it's amazing, and I think it's wonderful to see all of you women driving this as well, because we've got amazing women scientists behind a lot of this amazing technology as well. So I think you've been absolutely wonderful. I think there's been great questions, so thank you to the audience. If there's any other questions, I've got a couple of minutes, maybe just a minute left, but really I'd encourage everyone, so thank you to all of you. I mean, it's just so great to have such an interactive discussion. I'd encourage everyone online to go to the website, so look at the work that's being done by MSI Reproductive Choices around the world, to access AFIA, look at all that amazing work, and also come to the C4 website. So that's the Cervical Cancer Centre of Research Excellence. It's a fantastic initiative. We're working in, as I mentioned, Vanuatu, as well as the Western Highlands of Papua New Guinea, but we're looking to support the work going on in Timor-Leste, the Solomon Islands, and Tuvalu, amongst many other countries. So, we all have to collaborate together, of course. So Aidan has recorded this session, and it's going to be available on their website and YouTube channel over the coming days. And of course, as we know, tomorrow is International Women's Day. And just, I urge you all to collectively think how we can, crack the code. I think that's one of the themes, and ensure that these wonderful innovations and technologies are used to support true equity and true gender equity, but equity also between women in different parts of the world and in the same countries as well. So thank you. And I'm going to hand to you, Julie.
Wow, women are just wonderful, are they not? What a fantastic panel. I just love the enthusiasm and excitement just to keep working at bigger and better solutions. It's incredible. On behalf of the Aiden audience, I want to thank you, Deb, and the amazing panel. Thank you, Whitney and Daphne, for getting up and having a coffee with us and juggling your lives and dropping your babies and sharing just the incredible work that you're doing. It is exciting, it's hopeful, it's uplifting, it's amazing. For those of you who did participate and lean in today, thank you. It really helps the session and everybody to lighten the load if we get your comments. If you didn't get a chance to participate and you've still got questions, want to know what's going on, then reach out to Emily and me. We'll do our best to direct your questions and get the right answers for you. But thanks again, and that's a wrap. And happy International Women's Day, everybody. It was awesome. Thanks so much. See you later. Have a great night. Day.
Thank you all.
Bye.
Thanks, everybody.
See ya.